I went to bed one night as normal. Got up the next morning, I couldn't breathe. I didn't know I had it. And made my way to the hospital. And I got inside the door, sat down in one of the chairs, and the cleaner found me. I didn't even know what COPD was. And it came on that quick.
Quite often patients will allow their symptoms to deteriorate in the hope that things will simply get better spontaneously, which of course they don't. And they don't want to be a burden on their family members. They tend to be in denial. And the likely outcome of all this is that they end up in the emergency room, probably subsequently admitted to hospital, eventually discharged maybe 8, 9, 10 days later. The medical side of things has been fixed, but there's no plan in place to prevent that patient coming back into hospital again when the whole cycle repeats itself.
I was in and out of the hospital a lot. I find since I'm involved in this program, they're keeping me out of the hospital.
Following the research that we had done and our understanding of how awful it is to live with advanced chronic obstructive pulmonary disease, we developed a program that had proven to be effective in other settings and brought those components into a program that we felt we could deliver in the patient's home, which is where they wanted it to be delivered.
You know, it's hard to go out and get groceries, much less get myself to the doctor. So having Leslie come in and help me out and check me out, that's the greatest thing ever.
We are an interdisciplinary team, which means we have respiratory therapists, advanced care planner, social worker, myself, I'm a nurse practitioner, and we work with people in their homes to provide healthcare, education, support to the patients and their families.
They've always got useful information for me, whereas before, I couldn't get that.
Often they're socially isolated because of their breathlessness and their inability to get out of their homes. And majority who we've had lately don't have a primary care provider, a family physician, or a nurse practitioner. So part of my role here in Halifax has been to take on that role in their home as well.
What we wanted to do when we set up the program was simply improve the experience of living with advanced COPD, and found as an added benefit this enormous reduction in reliance on healthcare facilities.
Just last week, I probably would have ended up in Emerge again, had it have not been for calling Leslie.
For every dollar invested in Inspire, there's a cost aversion or a cost saving of $21. So it's hugely cost effective.
It's checking all the boxes of what I believe healthcare should be and what the future of healthcare needs to look like, especially in the province of Nova Scotia. We have these types of programs that are extremely successful and provide high quality care to these individuals who really need it the most. And in addition to that, save a bunch of money.
This works for me, and it works for a lot of other people like me, because this sure takes a big load off me, out of my mind. I'm grateful for that. Nobody knows how grateful I am for that.